Nicaragua is a country with great beauty, but it is also the second poorest country in the Western Hemisphere. A poor child in Nicaragua is 3 times more likely to die than a child who is not poor, and 6 times more likely to die than children in the US. These children often die from completely preventable illnesses like diarrhea and pneumonia. Conditions such as anemia and malnutrition contribute to these deaths.
As a physician trained in the United States, it is really hard to imagine kids dying from something as treatable and preventable as diarrhea and pneumonia. But when you see the conditions here in Nicaragua, it's much easier to understand why it happens.
The communities are spread out, and the poorest people are often driven further and further onto undesirable land in search of a way to support their families. They are subsistence farmers and sharecroppers who often live hand to mouth. The families they struggle to support are large, and their houses are small. Cooking is a full-time job for the women, and their indoor wood-burning stoves fill their tiny kitchens with smoke because of the lack of ventilation, which leads to asthma and respiratory infections. The dirt floors in their houses, as well as the lack of clean water and sanitation, are problems that lead to diarrhea and parasitic infections. In the struggle to survive each day, illness takes a huge toll on a family. Just to get to the nearest health clinic takes up to 3 hours by foot. And when they get to the clinics, they're often overcrowded or lack medicine. The result can be fatal for both mothers and their children, who often die from unnecessary and completely preventable illnesses.
In Nicaragua, the most vulnerable people, they're the ones who live the farthest away and they don't have access to health care. So this is where AMOS comes in. This is where we work.
AMOS Health+Hope is a Christian public health organization dedicated to improving the health of vulnerable populations in Nicaragua by working alongside them in health, education, and development. We primarily serve women and children who are living in the hardest to get to locations.
We have a heart to serve people in remote rural locations, and this is why we founded AMOS in 2006, so that together with other people, we could serve rural populations and improve their health.
We were very careful not to force our presence. What we wanted to do was to partner with them in health, and so upon their invitation, we began to work with them. What we're trying to do is to share knowledge so that the people would become empowered. This is why we chose the name AMOS for the ministry. It stands for a ministry of sharing health and hope.
AMOS is also a prophet in the Bible who cared deeply for the poor and spoke out against injustice. And the challenge of this work is a challenge for all of us working in global health, because the new frontier is not necessarily new vaccines or new medicines or even new ways to save lives. The new frontier is how do we get these proven, life-saving, simple technologies to the people who need it the most.
AMOS trains local leaders to become health promoters, to provide both preventative and curative care at every stage of life. This is part of a strategy called community-based primary health care. Simply put, it's health care for the people and by the people. It begins before a baby is born, as mothers receive vitamins and education about signs of danger during pregnancy. The health promoters monitor the mother throughout her pregnancy to make sure she gets adequate prenatal care. They're trained to recognize the potentially life-threatening conditions that can occur in the wake of a delivery, and they know exactly how to help. Because of this training, fewer mothers die, more babies survive, and eventually, through ongoing education and accompaniment, these children and mothers go on to thrive. AMOS works on an invitation-only basis. A community must ask us for help before we can begin working with them. Once invited, we help the community to get organized. This process begins as the community elects local leaders to represent them on a health committee. They also select one leader to become a health promoter. This promoter will receive special training in order to work in conjunction with the committee to provide basic health services for the entire community. Just as individual care begins with a diagnosis, so proper care for a community begins by understanding what's going on, a community diagnosis. At AMOS, we start by listening and seeking to understand the health problems and priorities of the people themselves from their point of view. Then we discuss what options are available and how we can take action together. Community organization makes change possible. One of the first steps in community organizing involves a census. AMOS teaches the health committee to go from door to door to every single house with the attitude that everyone must be counted and everyone counts. The census helps communities become aware of their strengths and weaknesses. Perhaps some families lack access to clean drinking water. Others may not have adequate sanitation. The census allows the community to gather all this data in one place and understand what's going on. Once the community has a clear idea of what they're facing, it's time to take action. Empowerment is at the core of everything that AMOS does. We encourage the community to use the census to make a plan for the year, which includes concrete, achievable goals such as reducing malnutrition rates, improving sanitation, and providing more education. We provide the health promoters with proven tools and techniques that they can use to create lasting change in their community. In addition, we seek opportunities to collaborate and coordinate activities with the local government, other organizations, and churches to work together to achieve improved health in these communities. In order to support these local leaders, AMOS has a field team of nurses, physicians, and support staff who work together to train health promoters, accompany them in the field, and walk alongside community leaders to monitor and evaluate projects. When all of these elements come together, we see more life than death. Children are healthier because parents are educated about proper hygiene and nutrition, which means they can go to school and not be sick. Mothers have less risk of dying during childbirth and receive frequent home visits to ensure the health of their newborns. Cases of pneumonia and severe dehydration from diarrhea are diagnosed and treated correctly with easy-to-follow protocols. When people have knowledge, that knowledge is power, and it changes the quality of life. Please join us in training local leaders. Together, we are providing healthcare in some of the hardest to reach places of Nicaragua for the people who need it the most. Not only that, we are moving toward a place of empowerment and hope, where communities are strong and united.